present officially George Souza, who is the new member of the SEMIC team. You probably know him from his previous involvement in CPSV-AP, but I'll give him briefly the floor so he can present himself. So George, please.
So thank you, Natasha. Hi to all. Like Natasha said, I've joined the SEMIC team recently. In January, I'm from Portugal. I worked with the Portuguese services catalog, and I've been following SEMIC for quite some time, trying to develop the Portuguese catalog of services and also the data catalog. So I had this opportunity of joining the team in SEMIC, and I hope to be of help, and if I can. Thank you.
Thank you, George, and welcome. So the agenda for today is we are having this webinar because we decided to focus on two major issues that we see in CPSV-AP. One is issue number 137, which is the generic versus instant level public services. So this will be one of the topics we're going to discuss today, and we're going to have three national experiences shared, one from Norway, one from Netherlands, and one from Portugal, to see how how they target and address this issue in their national implementations. After the presentations, we're going to have an open discussion to see how the people feel about it and what should be the approach from now on. Then we're going to focus on another issue that we have in CPSV-AP, and this is related to the procedures and if we need or not a procedural class in the application profile. This is something we're going to discuss also, and we're going to conclude the webinar. So starting with the first issue that we are targeting today, issue 137, which is generic versus instant level public services. Before proceeding with the different national implementations, just to give you a bit of context of what it is about. So we see that in many countries, the same public service is mandated by national law, but it is delivered locally by different municipalities. So each local implementation shares the same description, legal basis, eligibility criteria, but there is a different competent authority, contact point, and delivery channel. So currently in CPSV-AP, we don't have a mechanism to distinguish between these two different levels. And the motivation is if within one single class, catalogs are forced to duplicate the same service per municipality. So we're going to see how different member states deal with this topic and what should be the decision for CPSV-AP. So first, we're going to have the presentation from, from Norway, and I give the floor to Jim Young to present how they are dealing with this topic in their implementation.
Thank you, Natasha. Good morning, everyone. I will walk you through our need for generic services. The word generic in quotation marks, I will come back to that, why we don't use generic, the word generic. I'm with the Norwegian Digitalization Agency. Our agency is responsible for the Norwegian application profile of CPSV-AP. And our agency is also responsible for the National Data Catalog, which also includes a part which is the publicities or service and events. Next, please. Click, please. I will use only one example. This is only one of the examples from the Norwegian law. This is the Norwegian Education Act, which in general, this is the general overview of the act. this act has 7 parts. Part 1 is the introductional rules, what this act is about, the definitions, etc. Part 2 is about the primary and the lower secondary education. You can see which is highlighted that the chapter deals about the general right and obligation to attend primary and lower secondary education, both the right and also the obligation for the children in the right ages to attend the primary and also lower secondary education. Chapter 3 is about some specific rights. When you have the need, you have the rights to have, for instance, education in the given language, because although Norway is a small country, Norway is actually a multilingual country. So we have at least 3 languages that children have to have their education both in and Chapter 4, for instance, is specific rights to have transport if you have different roads or long distance from to the school. You have rights to have public transportation to bring you from the home to your school or and the way back home. And you have also right to have homework assistance and also after school programs. You can stay at the school after after the hours at the school, etc. Part 3 is similar to part 2, but it's about the upper secondary education and the training. And there are other chapters, for instance, chapter 4, chapter 6 and 7 have also several specific rights stated. Next, please. This is from chapter 2, which is about the general rights and obligations. I have only taken from 2 sections, section 2.1 and section 2.2. Section 2.1 it is about the general right to attend. The Act says that the children have a right to attend public primary and lower secondary education. So that's a mandated right in the Norwegian law that children have the right to attend. Section 2.2 says that children are obliged to attend. You don't only have the right, but you have to attend the primary and the lower secondary education. So it's an obligation to attend the education. Section 28.1 is from another chapter, which says that the municipality shall fulfill the right to primary and lower secondary education. Next, click. So this implicitly says that, just for those examples, that the primary and lower secondary education is a public service that every municipality shall provide. So this is understanding of the Act, the Norwegian Education Act. Next, please. From section 4.4, home assistance, the Act says that the municipality shall offer homework assistance free of charge to primary school and lower secondary pupils. Section 4.5 says about the after-school programs, says that the municipality shall offer after-school programs for pupils, etc. And the section 11.13, educational and psychological services, which says that the municipality and the county, because this is a general for both the primary and lower secondary education, and also higher education, which is the county responsibility. So this is a rule about both the municipality and the county. But it says that the municipality, if we focus on the municipality shall have an educational and psychological service who have this kind of a need. Click, please. So this is explicitly the rule that homework, just for those examples, homework assistance, after school programs, educational and psychological service are public services that every municipality shall provide. So if you read the Educational Act in Norway, you can understand services that are implicitly mandated and also services that are explicitly mandated. So in Norway, we need a statutory service, in parentheses, generic service. Why we don't use the generic service, the term, because this is a sort of information modeling term, but for the people in the field, they don't like the word generic, but they say that those are the services that are mandated in the law, in the Education Act. So it's statutory services. I used, as I said, I used only one example, the Education Act, but we have many other acts. It's about 220 statutory services that the municipality level in Norway. Right. So every municipality should provide those approximately 220 statutory services. And every municipality needs to describe those services in addition to describe specific informations for each municipality, for instance, contact points, opening hours, etc. Norway is a small country, but we have currently 357 municipalities. So it's 357 times 220 services that have to be described. If we use the 80-20 principle, so it's about 80% of the information, which is common statutory services. 20% of the information are specific for each municipality. So similarly, at the county level, although we have fewer counties and also fewer services per county, we have there are also services, as I also used in the example, the education, because the higher secondary education is the responsibilities of the counties in Norway. So we have similar needs in Norway at the county level, that there are statutory services that every county has to provide and that every county thus has to describe. Next, please. In Norway, we have actually already a catalog of all those about 220 statutory municipality services described. This is a catalog maintained by a company which is owned by the Norwegian Association of Local and Regional Authorities. But this catalog is not yet harvested into the national catalog of services and events because we don't have the mechanism to deal with the description of those statutory services that don't have any specific competent authority, for instance. So next, please. And we have also a proposed and a planned so-called Common Municipality Service Catalog, which is a part of a project that the Association of Local and Regional Authorities has been running. So in this project, we have proposed a Common Municipality Service Catalog. This is a Archimate drawing. At the most left side, those are the capabilities for providing services. In order to provide a service, you have to have an overview of the services at the municipality level in order to provide municipal services. you have to have an overview of the municipal services. So at the data level or metadata, you have to have the description of the services in order to have an overview of the services. And as I presented at the municipality level, I have descriptions of those statutory services, in parentheses, generic service, in order to have an overview of the municipal public services. And at the right-hand side, most right-hand side, we have the specifications which the data or the catalog have to implement. We have the Norwegian application profile, CPSV-AP. As I said, our agency is responsible for the specification. And this CPSV-AP is a specialization of CPSV-AP. So we have to, at least at the national level, in CPSV-AP NO, the Norwegian application profile, we have to deal with the mechanisms for describing statutory services. Next, please. The difference is that at the level of statutory service, which is the so-called generic service, we need, for instance, a mechanism to say if this service is at the national or regional or local level. In Norway, it's the state level, the county level, or the municipal level. Instead of to have a specific competent authority, because this is a service that is mandated in law for every and each municipality. So it's not one single competent authority. So that's what I had prepared to introduce to you our needs and also sort of our solution. We have chosen to call it statutory service instead of generic service, in addition to public service, which is already in CPSV-AP. Thank you.
Thank you, Tim. Okay, we will proceed now with the next presentation that comes from Netherlands, and the floor is yours. Thank you.
Hello, everyone. Thank you so much for the opportunity to share our ideas. I'm Marco from the Netherlands. I've been involved with the CPSV community and working group for over 10 years now, representing the Netherlands. Within our country, my colleagues and I, we work on solutions for interoperability, especially where it concerns public services. Could you move to the next slide, please? Thank you. So within the Netherlands, we have public services and their descriptions at two levels, a bit like the presentation from Norway, I guess. We have generic and specific services. For instance, we have a generic description for applying for an alcohol license, which has several of the properties from the CPSV-AP, like a legal resource, rules, and a business event. But it does not have a competent authority or spatial attributes. Since it's generic, it's for all municipalities at once. It's a generic description and not specific to one organization or area. We do, however, know that this is a service that is offered by municipalities and, for instance, not by provinces or counties or water boards, which we have in the Netherlands. So we do have a administrative level, or government level, like Jim mentioned earlier. So we have a similar situation as the one presented just now for Norway. Apart from these generic service descriptions, we also have specific service descriptions, one for each of the organizations offering the service, like in this case, the municipality of Castricum. And these descriptions, of course, have all of the properties from CPSV-AP, such as a competent authority, a legal resource, and a specific channel for the municipality of Castricum. Next slide, please. Yeah, the distinction between generic and specific service descriptions is also reflected in the way we have implemented the SDG Annex 1, the information areas. We have both generic descriptions that are written and managed on a national level. and presented on a national portal. We have basically 4 national portals in the Netherlands, 2 for citizens and 2 for business, 1 in English and 1 in Dutch, with the specific descriptions that are supplied by local or regional authorities. So we have generic descriptions at a national level, and they are the specific descriptions from municipalities, for example, are added to them. Yeah, thank you so much. This is a concrete example from our SDG pages. On the left hand, you see the business.gov.nl portal. You see the generic service description for an alcohol license. And if you enter the name of your municipality on the bottom, the specific description pops up. And like I said, this description is provided by the municipalities themselves. Next slide, please. So apart from the SDG implementation, in the Netherlands, we have a catalog of both generic and specific services or instances, and we can express those as linked data, as you see here. So we have a catalog of approximately 1,300 generic services and some 55,000 specific services. And we can export them or express them as linked data. Maybe the syntax is not entirely valid. It's something we're working on. It's a work in progress, but you get the idea. Note that we've also added a instance of link between the two, and that goes both ways. So for a specific service description, you can say it's an implementation of the generic service of supplying an alcohol license in this case. Next slide, please. So, as was mentioned in the issue on GitHub, the CPSV-AP at the moment lacks this distinction, and it forces you to specify a competent authority for each public service, which makes it hard to use it for generic service descriptions. And since we want to use the CPSV model as a blueprint in the Netherlands, or perhaps an upper ontology in technical terms, for our national implementations, we consider this to be a problem, for which we see basically 2 possible solutions. Let me see. The first option would be to use the existing concept class from the public CPSV model to model the generic services, and using the classified by relation to link to specific services. And the second option would be like, it would be similar to the Norwegian proposal, I guess, is to keep using the public service class for both generic and specific services, but make some changes. And I will go deeper into both options in the next slides. So what you see here is option 1, modeling the generic services as a concept, as a way of classifying the specific services that are modeled as a public service in the middle. Next slide, please. And because the concept class is so generic, it is easy to specify national
I think I can continue where Marco left off.
Please do.
Yeah, okay. Well, because the general SCOS concept is quite generic, it gives you the ability by connecting it or implementing it in a local model where you can actually model the country-specific elements that you would like to combine with such a concept. And to refer to the work that Norway presented, for instance, is basically if you say this is on a municipal level, that's something that we would model here in our bestuurslaag. So basically what we do here is that the generic concepts as they are referred, there's Marco. Marco, I was just stepping in because you
Okay, great. Sorry,
take
ladies,
over
to
again,
take
please.
notes.
You were doing a fine job, so please.
Okay, thank you so much. All right, where did I leave off? Oh yeah, because the concept class is so generic, it is easy to specify national or even regional properties for generic services. And another advantage is that the CPSV-AP model can stay the way it is. The concept class is already present. The relation to public services is also there. But the downside is that in this way, the generic services cannot make use of the existing relations and properties of the CPSV, such as legal resources, rules, or output. The concept class is a different class from the public service class. So the generic service would be modeled as a class separate from the public service altogether. And next slide, please. So as I mentioned, option 2 would be to use the public service class for both generic and specific services. We could add a property to specify the service level or government level, as Jim proposed earlier, which could be either generic or specific. Also, we would have to add an instance of relationship between the two. And of course, fix the relation to the public organization, for which we see two options basically. One would be to make it mandatory for specific services only. And an alternative could be to allow the specification of generic organizations or government levels or administrative layers instead of specific organizations. So that's a consideration. This option 2 would make optimal use of the existing properties and relations of the CPSV-AP, since most of them already apply to both generic and specific public services. For instance, they both have a relation to a legal framework, to legal resources, etc. And on the downside, well, it would mean changing the CPSV-AP model at its core, which would be could be an objection. And the distinction between the two levels would not be as explicit as in the first option, perhaps. Next slide, please. So like Norway, we are working on a CPSV-NL application profile. And we is Logius, the company that's responsible for basically for the standardization of service descriptions. And we are using the working title CPSV-NL. We found that implementations within the Netherlands lack the proper core model, and that the European model is not on everyone's radar. So with the CPSV-NL, our aim is to make Dutch implementations more interoperable, both within our country and within the EU. And in this model, we do make an explicit distinction between generic and specific services. Next slide, please. So here we see the model for generic services in red in the middle. And most of the other classes should be familiar from CPSV-AP. But as you can see, the generic service has no link to a competent authority and no spatial attributes. But there is an instance of link to the specific services in the upper left, which we can see in the next slide. So this is basically the same picture, just with specific public services in the middle, which does have a responsible organization on the right. And there is also the has instance link because generic services have multiple instances, one for each municipality, for example. Next slide, please. And in this image, which is basically our information model at the moment, we have combined both the generic and specific services in the middle. So to summarize, in the Netherlands, we think it would be very useful to make a distinction between generic and specific services within the CPSV-AP model, because at the moment it is not clear how to model these. And that is not good for interoperability, I guess. Leaving it open to each member state to solve this issue. We saw that the Flemish, I guess, the Belgians, also had their own way of implementing this distinction. I guess every member state is having an issue with this and solving it for themselves. That's not beneficial for interoperability. So we hope we can find a solution that would work for all of us. So thank you for your attention. And if there are any questions, I'm looking forward to the discussion later on.
Thank you, Marco. Thank you very much. Up to now, it's evident that there is a need to handle this issue probably at the CPSV-AP level. But let's also see the presentation from Portugal, that the approach is going to present it by George. And after, in the open discussion, let's see how we can address this issue at the top level. So George, the floor is yours now.
Thank you, Natasha. Well, first of all, it might be weird being me presenting this, but I was the one involved in the process in Portugal for the past years, so we thought I might be the best option to present because knowing the case as I know. In Portugal, we have more or less the same issues that we saw with Norway and the Netherlands. The Simplex program back in 2011, following the Services Directive and the whole concept of simplifying public services and more or less normalizing public services around municipalities, because there was a lot of diversity and each municipality doing things on their own. Laws started coming out trying to level the field. So a lot of legislation starting from 2011 started producing law at the national level that then would place place municipalities as the competent authorities in several cases. And those municipalities then would have the right to fine-tune their specificities within each territory. So good examples of this are local lodging, when you want to register your private home as a tourism lodging facility. This is quite common in Portugal, but the municipality is the one deciding in the end if you can or cannot register, if you have the conditions to register your house as a lodging option. Also with occupying public space for terrace, for restaurants and cafeterias, etc. Also for building and construction. So we are talking about a vast number of procedures that each municipality has the right to specify, even though they are like some examples that we saw here in the rules of 80-20, 80% of the information is more or less common to all because it's defined at the national level. But then they have the right to specify particular things according to location, to custom, and their own rules, of course. So in terms of local lodging, we are talking about around 9 to 10 different procedures that multiply for the 308 possible municipalities in Portugal. Occupying public space, we're talking 36 procedures that multiply again by the 308. And in terms of building and construction, the last survey we had, it would be around 200 different procedures, so multiplying also by 308. So as you can see, the number of instances of these procedures is quite vast. In practice, because these were all licensing procedures related to the Services Directive, next slide please, we had to put them in our point of single contact. And since then, since 2014, we've been converging all public services into one portal. Today it's gov.pt. It had many names in the past, with the general idea that for the citizen, this should be totally transparent. So it should be a non-question. The citizen knows where he lives, he knows what he wants to do. So it should go to a portal, choose this municipality, right? Establish the location. So that defines which competent authority, in this case, would issue the license for him. And he has to have access to the specificities of that location, so that service, right? So for the citizen, he's accessing a public service on its own, so a granular public service. So what we did was, next slide, please. In practice, we ended up deciding that, can you change the slide? We ended up deciding that what is a service? So a service is a procedure, a definition, and a competent authority. It doesn't exist without these three parts. So what we did was we solved the issue in the software managing the catalog, but we didn't change the model. Okay, so generic definitions can be introduced by the governing authority of the catalog, which is the agency running the catalog. Okay, each competent authority, each municipality only introduced the specificities, but the service only exists when it's complete. Okay, so our approach was actually do nothing. We solved it with artifacts on the software, but we didn't define it at the model level. Okay, so the software allows for this abstract pre-service, but the service itself doesn't exist unless the authority, it's instantiated and the authority fills in all the necessary information for that specific municipality. Okay, so to finalize, next slide, the main question here, in my opinion, is what are the minimum required elements that define a public service? So should we change CPSV, or is CPSV enough for what we need? And we should allow for the service, decide that the service only exists if it's complete. So the rule that was mentioned, that a service needs to have a competent authority, should not be broken. And anything that we add to the model, that's the main reason why we decided not to add anything, because that rule, it's the core of the model. And anything that we add on it, it will probably complicate our lives a lot in the future, because then we need to add other stuff to compensate for that. So yeah, so sorry for the anticlimax, but our solution was not to do anything in terms of CPSV. But of course, this is open for discussion. That's it.
Thank you, George. So, do we have any reactions or thoughts or implementations to be shared by our audience? I know that we don't have the participation today in this webinar. It's quite low, but unfortunately, there are two other events taking place at the same time: the Interoperable Europe Board meeting and also the SDG Coordinators Cafe. So it's good that we have the option today to discuss this and have a more structured proposal that we can follow up during the next webinar and take a decision how we should tackle this issue, either at CPSV AP level or its member states should deal separately as it is the case now. If someone from the participants wants to take the floor, please raise your hand. Otherwise, would you like to participate and answer this question through the chat or the Slido as we have?
I don't know if I am allowed to take the floor, but I would like to.
Yes,
I
please.
think what we have seen in the three presentations here is if I look at the story of Norway, and if I look at the story of the Netherlands, and if I look at the story in Portugal, we basically all face the same challenge. Yeah. And basically, we've all chosen for a similar solution, but we implemented that solution slightly different. So what you see in Norway, they need a separation between the more statutory services and the local implemented services. And they solve that by creating their separate meta models outside of CPSV and create a relation with the CPSV instance, with the CPSV instantiated model. If you look at the solution in Portugal that George presented, they've done the same. They created a separate meta model, basically in the software that registers all the services, and implemented the services at local instance level for all the municipalities, etc. But basically, in core, they did the same. They created that separate meta model to describe the generic level of the services. If I look at the solution, the possible solutions that the Netherlands presented, we are also basically doing the same, where one of the options is to distinguish within the CPSV model itself, which I personally think is a little bit complex. The first option that was presented by Marco is where we basically describe the generic service via the SCOS concept. That gives us the ability to basically create a separate meta model for the generic services outside. In the Netherlands, we are in a very fortunate position that it's a SCOS concept. We also have a Dutch standard, it's called NL SBB, which stands for basically the Dutch way of describing SCOS concepts. And in that, we do have a formalized way to link to legislation, etc., etc. So if we create our model attached to that SCOS concept, we also have the possibility to actually refer to the statutory laws and also to the local laws from that SCOS concept class. So that way we can create our external meta model and still anchor it to all the generic elements as they are being mentioned in the CPSV model, like which layer of the government is responsible for this, what's the relation with the law, is it something, so then the CPSV will be isolated to just saying, this is your alcohol permit for this bar in this part of the city of Amsterdam, to what do you need to get to have an alcohol permit. And I think CPSV is intended to be used as your local alcohol permit in your local bar in a particular city, to describe that, to model that, to provide our citizens with the information that I live here, I need to know what I need to do to establish that. But next to that, we need a generic description to relate it to the law, that people can check, hey, my municipality offers me this. Is that in accordance to what I can expect from a municipality in general? And so, yeah, that's basically the way we are looking in the room. We are looking at this particular challenge.
Yes, George. I
Am I the only hand raised? No.
I think so. This is what I'm taking. Yes.
Okay.
So please.
Yeah, no, the thing is that's why I chose to leave that question in the end, because of course the main it comes back. I think it at least in my head. Sorry, I keep coming back to okay. Do we want to describe those generic services somewhere? Are they services without the competent authority, right? If they are, so we can catalog, we want to catalog them, right? So it makes sense to represent them in the model and to have a way of creating those concepts in a more tangible way. But I keep coming back to the same question: is this an artifact of our need to manage the information? So we need to make it easier for people managing the information, that they don't have to fill in. So we want that 80% of the information constant and accurate, managed only by one meta authority, and all the others just change what they need. Or do we need that? Does it exist as a thing without having the final competent authority attached to it? If yes, then okay, I agree, we should change the model. If not, again, I think it's an artifact of the management of the catalog, and each implementation should manage it the way they find more useful. Because in the end, the public service will be the instance, the granular instance, not that national generic description. Maybe I'm wrong. It's just my idea, just my 2 cents.
Any more comments on it? Proposals or different implementations to share?
Ana Rosa, I think, has some hand raised.
Okay.
Yes, thanks. I think that the model, how each member state design a public service, I'm not using the word modeling, but design. It's quite different. In Spain, we have a very complex system, but in general, the public service works depending on the legislation, and the legislation can be provided at the national level, independently of who is providing the public service. So in that regard, we have what you call general public services, because the regulation is at national level, but the competent authorities can be regional authorities or municipal authorities. But also we have public services that are not just specific ones. I mean, they are not regulated by the same public authority that provide the service. But we have, I think George has a similar situation. The public service is regulated at general level, but then there are specific regulations for each competence authority, for for particularities on the provision of each provider. So at the end, in Spain, the difference comes from the legislation, how the public service is regulated, by whom, who is the regulator. Is only one competent authority? There are different competent authorities independently, or there are a common framework and then a specific regulator as an instance of the general regulator regulation. So trying to model this complexity, covering all the cases of all member states, I think it could have a big impact. So we need first to know what we want the CPSV to be. I mean, we want to have a core vocabulary, and then each member states can create their own application profile, or we want to cover all the possible situations in Europe. Then the complexity of the model will increase, of course. So I think that the first question is, if we want to have a basic core vocabulary or enough to be expandable for the necessities of each member states, or we want to create a complete model that covers all the possible situation. In the latter case, then what we need is to gather all the cases, the Portuguese, the Spanish, the Norwegian, the Netherlands, and then to try to model all the specificities. From my point of view, that is not a good situation, because complexity leads to blockage. So I would like to have a basic core vocabulary that can be flexible enough to be adapted to each national reality. Thank you very much.
Thank you, Ana Rosa. Yes, if I can also share my view on it, I agree with you. If we try to cover all possible cases in the member states, then we will end up with a very complex model, but maybe it's worth investigating what is the different cases for each member state, and as George asked in his last slide, see what are the minimum requirements that cover all these cases, and then we see how we can approach it. It would also be either, if we don't proceed with this approach, it would be useful to see what are the different cases that we have in each member states. Maybe this is worth investigating. Are there any other hands raised?
Marco's hand is raised.
Oh, because I cannot see any hands. So please, Marco. Yes.
Yeah, thank you. I would like to add, within the Netherlands, we use this CPSV also as a blueprint for national implementations, as guidelines, basically. So we have use cases where generic service descriptions are, in fact, exchanged. So there is a need for interoperability and a need for guidelines how to do it. For instance, we have national editors at the national authority level writing these generic texts and distributing them to municipalities so that they can use the descriptions as a basis for their own local descriptions, which is very helpful. We call them generic text. This is also the way in which our SDG implementation works. So we look not only to the CPSV for interoperability with other member states, but also within our country to make things easier. And I would like to add finally, regardless of the solution which we pick, do nothing or expand the model or model it as a concept or as a public service with a non-mandatory relation with the organization, doesn't matter. At the moment, there are no guidelines, and we see that each member state does it in its own way. So some basic guidelines would be the least, we would at least like some basic guidelines within the CPSV-AP on how to handle this. And if the guidelines are do it at your own local or national, do it in your own national way, that's fine with me, but at the moment there's nothing. So some clarity on this would be a basic, the basic requirement, I guess. Thank you.
Thank you, Marco. Well noted. Okay, the guidelines is something that we will work on. And I would like to, okay, Jim, I see you have your hand raised, so please.
Yeah, thank you. About if there is a need at the European level, there are two things. The one is if there is a European catalog of services. There is not yet.
Yes.
But when there will be a European catalog of services, then it's obvious that we have to have one single specification for that catalog. That's the one need, which is not there yet, at least not officially. SDG, for instance, doesn't say that it must be a European catalog of services, which automatically harvests from the national catalogs, for instance. So that's one need, which is not there. The other one is the question, general question, if SEMIC specifications are common specifications for all member states, as Marco said. We, at the national level, we need common specifications, call it a blueprint or whatever. We need to have a specification for how to do that. It's not a guideline, it's a specification. Because we need, at the national level, need to have interoperability already between the different authorities, etc. We may even one day communicate with Netherlands, for instance. Not mandated by the European SDG, for instance, but we may need to have interoperability with other countries. So that's two different needs. One is if there is a common European catalog of services. The other one is if we need a common specification specified by SEMIC that all the member states can use. So two different discussions, actually. Thank you.
Yeah,
Thank
just
you.
to, sorry, Natasha, if I can try. Marco, you still have your hand raised. I don't know if you can, okay.
No, sorry.
No problem. Just just replying to Jim, in terms of SDG, it would be useful to have some sort of project or pilot to start building the EU catalog, and that, of course, makes sense. I don't know if it makes sense in terms of SDG, because most, I would say, the majority of the information on SDG is probably non-specific public service related. You know, Annex 1 has a lot of information that doesn't concern the public services in itself, and that probably was the reason why your Europe portal is not using CPSV as a basis to. But okay, but we're working on it. We will try and have something on that field. One thing I agree with, and you mentioned the point, the crucial point is interoperability. And yes, we need to have at least guidelines to assure that even if countries do their own specifications on CPSV to address this problem, they don't break interoperability. So they don't make their own application profile so complex in order to solve this, that they break the core vocabulary in terms of interoperability with the rest of the member states. Yes. So yeah, I also agree that we would at least have to have some know the problem a bit better and have some guidelines that could help at least not break that interoperability. If then we can evolve into something into your Europe, that's another question. It involves other colleagues in other projects. We're looking at it, but no, I wouldn't say anything for now. Yeah. I don't know, Natasha, if we move to the next topic, or I think the topics are related, so we will come back to that probably in the next hour. Yeah.
Yeah. However, is there anyone else that would like to share her view or the way of implementing or dealing with this issue? I see that we have from Belgium Bart in the audience, so I don't know if Bart, you would like to say a few things or not. Probably not. Okay. If we don't have any more comments, we can proceed with the next topic in the agenda. And of course, we can come back to this issue at the end. But what I would like, before proceeding, what I would like to say is that we cannot take a decision now. However, what we can do is have a call for action. So we can have, the issue is open in GitHub. We can have specific proposals that would be there available for our working group to study, look, and vote. So if we want to deal with this at the European level through CPSV-AP, we need to have proposals that will be assessed by the members of the working group and basically each member state, and see how this fits, and then continue with this discussion. Now we initiated it, we saw different implementations at member state level, but it's good to be able to have specific proposals and see more implementation. So please contribute to the open issue in GitHub with your specific proposals or thoughts on the proposal. So this is something that we need to do at the moment, and we can follow up on this during the not online, but through GitHub, and also in the following webinar. We don't know yet when it will take place, probably sometime in September. So having said that, I think we can move to our next topic. And for this, I think, Emidio, you are going to present it.
Yes, I don't know if it's possible to see also the result of the before
vote.
of the vote.
Yes.
Before that, what this is what we are trying to see. I personally cannot.
Okay,
but,
I see that because Oscar shared it, it's 78% votes. I would like this to be handled at European level.
Okay.
So this is, it's basically it's nine votes,
Okay.
because this.
I think.
But yes, so we have an idea what needs to be done, but we need more information. So please contribute on GitHub.
Okay, thank you. Indeed, in this part, let's say the second type of issue that we want to discuss is the introduction of the procedure in CPSV-AP. In CPSV-AP, there is already mention of procedure from the rule definition class. And at the same time, but this class is not there indeed, or this concept, this is not there. At the same time, we've done an investigation with the Your Europe portal, looking how, let's say, the portal works, and looking also at the regulation, the single digital gateway regulation in Article 3. There is indeed a definition of procedure over there, where it's defined as a structural sequence of action that the user must follow in order to fulfill the requirement or obtain a decision for a competent authority. Now, the thing is, this concept again is not there, and the idea is to make it indeed, or at least understand if there is a real need to add there from member states, or maybe this need is only for your portal. It's difficult indeed to represent procedure in this moment, and also it's difficult to structure this procedure. From the Euro portal, we have some already information. For example, differentiate between online or offline, if it's a national or local level. And also from the Annex 2 of the SDGR, we also have a classification procedure as well. So what I would say in that sense, there is some part from the regulation. On the other hand, we have some part from the Euro portal, but we would like to have a feedback also from member state perspective, if indeed there is a need to introduce such concept. In the next slide, what you can see is an example that we bring here. For example, in the public, an example of public service that we also bring inside the CPSV-AP specification, we have such online service to perform tax declaration. It's period of tax declaration. And the idea is to introduce this concept procedure that you see on top of the image. I hope you all can see it, where this procedure is connected through this public service via deliver through relation. And an example procedure would be submitting the tax return. So as an action from in this case, from the citizen to do the submission of tax return. Of course, then this procedure needs to comply or constrained by some rule or even legislation itself. For example, in the case of rule, all residents must file an annual income declaration by the end of April of each year. That's an example. So this procedure, of course, will have its an action, and at the same time is constrained by certain rules or legislation to be basically put in place. So it's in between the public service and the concept of rule or legislation. So properties can be discussed later on. We already mentioned this in the issue 139. The question is mostly, is there more a need? I think I remember Jim Young approving such a request. But you can comment, Jim, if possible. But indeed, if the discussion is open to all member states, and then give the floor, yeah, if possible, to you, Jim Young, and then to other member states. Thank you.
Yes, I
Maybe
can
Dan.
comment. I responded positively to the because we have discussed nationally that we actually also have a need about something like procedure, but we still don't yet know what is a procedure. The example that is presented in the issue is to submit a tax declaration. The service is to pay tax or the duty to pay tax. So it could be the result, could be the input. So we are still not there to figure out what is a procedure that needs to be described in connection to a public service. So we see the need, but where the need is comparing to the service. Is it to produce the input? If it's to produce the input, it's sort of in CPSV-AP. If it's something else, we don't see yet. So, but we see the need.
Indeed,
so
the input class,
the
input class is already there. We don't see it from the diagram here, but it's already there.
So as we read the example to submit a tax declaration, so it's sort of the result is the input to a service.
Yeah, this could be, or maybe a procedure, because we have, since we have an effective definition from this DGR, you see, inside this DGR, it's really defined as in the previous slide, we said that it's an act. So this could be, we can put it, it's a sequence actions that the user must fulfill. So either it's a type of input in a way, and that in that sense I would agree, that can be provided. But I don't know if other member states have the same need, first of all, or would define differently such type of concept.
Yeah, we have a hand raised.
Yes, please.
Yeah, Oli Huskainen.
Yeah, this is just from the SDGR coordination perspective that what is the relations of a procedure and a service in a service catalog. So as from the coordination perspective, we see the procedures they can consist many services in a service catalog. So in a way, a service is a sub procedure of a procedure. So in a way, it could be some kind of metadata that all of these services are connected to these procedures, which are defined in some regulation, let's say in SDGR. So this is the perspective from the coordination when we try to understand like all the services that are in the procedure of X1 in the Annex 2 of SDGR. Starting a business, so that could be a way, but I don't know how it will fit to the data model of CPSV-AP.
So in your case, you were saying that service would be so a procedure is a collection of services first, and the service could be a part of the procedure or sub part of the procedure. That's what I understand.
Yeah. because in many cases, one SDGR procedure consists many services in our catalog, and in like in the business permits there are like hundreds of them. So that's how it could be, but I don't know how it will fit to the data model.
No, yeah. Thank you. Indeed, on the right hand side, in the meantime, we open a poll just to understand indeed if this issue should be addressed by CPSV-AP, first of all, because again, as I said, this concept we understood that was useful for Europe, but was really needed also for CPSV-AP. That's why the first question here on the right hand side of the poll.
We have Ana Rosa with the hand raised.
Please, Ana Rosa. Thank you.
Thank you. In our catalog, we have a typology, a taxonomy of procedures and services. In our understanding, a procedure is, of course, a sequence of actions. However, you can have more complex or more simple procedures. For instance, in Annex 2 of SDGR, you have to obtain the birth certificate. That is a very simple procedure, which only needs an action, which is the application, and a second action, which is the issue of the proof of birth. So that is an example of a very easy procedure. Of course, there are other very complex procedures, like they said before, licenses, business licenses, which the actions you need to perform, to carry out, to complete the whole procedure includes many services, and each service also needs to carry out several actions. And also, for instance, which are the typical actions required by a procedure under our law. We have a general law, which is it is called the Common Administrative Procedure. It's a big legal umbrella for all the administrative procedures. So as minimum, you have for the procedure, you have the application, that is the action. You have, of course, the outcome of the application, which can be an output. An object, a concrete output, like the proof of birth, or can be a decision. But also you have an appeal, an appeal service. If you are not, you don't agree with the decision, then you have another action that you can carry out within the procedure, which is the administrative appeal, and then this is for instance, the more complex the procedure is, the more actions are included, and the more different types of actions are included. So, of course, a procedure is a sequence of actions. As I said, as minimum, the application and the outcome. These are two different actions. One is performed by the user, and the second one is performed by the competent authority. And we can also compare a procedure in contrast with, for instance, a health public service. A health public service has nothing to do with an administrative procedure. You don't make an appeal, you don't get a decision. That it is completely different. It is also a public service. It also has a public authority, a regulation, etc. But it is not an administrative procedure at all. And also the health public services, telecom public services, road public services. I mean, there are many public services which are not procedures. Thank
you. In that sense, Ana Rosa, you will be in favor to add that, let's say, for your needs, or in Spain, how is it done, or at least?
In Spain, we only model administrative procedure. We don't model other kind of public services. We don't model health public services. We don't model telecom public services. No, we only model administrative procedure, which are the ones which you can access through the public administration's online portals. So that's the only the only procedures the only services we model in our catalog, because it's normally the catalog is linked to the online portal, so you can access the online procedure, the online application through this portal, and where there are also procedures that are not initiated by the user, but they are initiated by the competent authorities, like the sanction procedures. And then the sanction procedure, of course, they don't have an application, an online application, but they have an information page to explain users how this sanction procedure works. So it is also coming from the catalog. In the catalog is also described what are the steps, what are the actions of the sanction procedure, what are the basic regulation, and who is responsible of who, because sanction procedure is initiated by the competent authority, but normally it requires documentation from the user to make some allegation or to prove anything the competent authority wants them to prove or whatever. So that are also a sequence of actions of a procedure that is not initiated by the user.
Okay. Thank you. It's clear. I think it's clear. Probably what you can do is sharing the link of we can access that link also on the portal of the public administration.
Well, we have hundreds, thousands of them. It's not so easy.
Okay, but then no. It's okay.
I can write a summary of. I can share the link to our public administration. Common administrative procedure law, which is in Spanish, but we can share that link.
No.
And that is explained the whole administrative procedure, the typical administrative procedure, including these procedures that can be initiated by competent authorities and not by user. And if you like, I can not now, because now we are quite busy, but I can make in some weeks a summary of what types of procedures and services we have in our catalogs, as I said, that are aimed to be published on the online portals of the public administrations, not for the health institution or education institution or whatever. So that is our focus.
I see George and Jim raising hands. George, please.
Yeah, I don't know if Jim's hand was the previous.
I don't know either.
Yeah. Well,
George, yeah.
I didn't want to raise my hand because I didn't want to influence the discussion, and I'm in a tricky position. I'm part of the team, but I was implementing this for quite some time, so I have my own personal opinions and views on this. Again, in Portugal, we had the objective, and we still have the objective of building one portal for all public services. So the idea is to model everything, whether it's an administrative procedure or a generic public service, or even something that is not a public service, but it's probably can be used within a public service. So we with some inspiration from the Norwegian model, for example, we generalized from public service to more open service, for example, so that we can accommodate things like insurance and other kinds of services that are not directly public authority related. It was curious to hear Ollie bringing up the concept of procedure from SDG. I don't know if I agree with you, Olive. Sorry, but the thing is, I think SDG, the way procedure is defined is wrong, because those procedures are not procedures at all. They're, the very least, are life events. They're not procedures. I see procedure more granular than public service. I would see, for example, a public service being, I want to license something, and the procedure being the opening the business, changing the business, closing the business, for example. That would be the administrative procedures related to my open concept public service of, for example, the local lodging I was showing a while ago. So I would say a local lodging has 10 procedures inside. So that being a public service, right? So I have registering a local lodging as a public service, and I associate 10 procedures to that public service. So 10 sequences of things, 10 legal acts that I can perform as a citizen related to that concept of public service. That said, I think, I don't know, we could have some sort of way of signaling which is the public service and which is the procedure in terms of granularity in the model. But I think the relation that public service already has with itself, that recursivity in itself, I think it's enough to represent what I just said, because being public services, those procedures can also be represented and described in the model. So I can have, and I think this is also a bit related with the previous issue we were discussing. So is a public service a generic thing, and they have procedures, and those are the concrete instances of that? And can we solve it with CPSV alone? Again, in the Portuguese model, we didn't want to complicate things, so we didn't want to add complexity to the model, and we tried to find ways of solving the problem with what we have already. And we didn't add procedure, even though we had the need to, or we felt the need to. And it's a question I've been raising a lot since I've been at SEMIC, to represent, for example, the procedural requirements that we need to model in terms of SDG, because you don't have that concept neither in CCCAV, neither in CPSV-AP, but it exists, I think, as a thing, the procedure requirement, the requirement that that procedure has for the citizen to fulfill. But it could be solved in different ways. It could be solved with an application profile of CCCAV, for example, and it's a thing that's outside of the scope of CPSV. Like I said, I answered in the poll, I don't know. I don't think we know enough to define. We need to learn more, and we need to figure this out with more time. But I'm happy that the issue is raised, because it's a thing, and we need to fix it a bit like the previous issue.
Jim?
Yes.
Yeah.
I don't know if Ollie want to comment.
Yes.
Yes. Okay. Ollie, go ahead.
Just a few words. I also answered, I don't know what is the best solution, because my point of view was just when we use our service catalog to understand which services are part of which procedure, that helps us. But I don't know what is the best way. Do we need the procedure in the model or not? And I have to, and also I'm not the competent authority of our service catalog, so I don't have a say to this. So we have to we have a meeting tomorrow, so we can have a conversation about also this, that how they see, because we have in our model, we have already in Finnish CPSV, we have already live events. They are different thing than the SDGR live events, and I don't know how they do they even mix well? So that's one thing to keep in mind. But yeah, I agree with George that we need more conversation about this. Thank you.
Okay. What both Anna Rosa and Olli said for a moment ago about the public procedures in the public administration. That's one thing. That also illustrates the difficulties that we met when we had the national discussions, what are called philosophical discussion. What is a procedure? What is a service? And what is a process in the architecture thinking? So we couldn't land because in public administration, you have rules for doing public procedures. That's one thing. That's not exactly the 29 or what is the number public procedures in SDGR. Because in SDG regulation, Annex 2, or what is the number of the annex, there are a number of concrete administrative procedures mentioned that every member states have to provide. So that's one thing. That's not exactly like the public procedures in the public administration in general. That's the one thing. So you have the procedures in SDG. Then again, you have the service. So we have to sort of think about procedure, whatever we call the thing, procedure, in relation to service, because CPSV is about service, not only procedure for itself. So that's why we couldn't land if we see the need. We have to describe something in connection to services. We may call it a procedure, but what it is, we couldn't land. So that's the difficulty we met. Yeah.
Then I don't know from the audience, let's say from the member states. No, we don't have other presence. I think from the poll we reached, let's say, 2, 3, let's say at least three votes for yes. And so that should be in CPSV-AP. So then I believe the discussion will have to continue over the GitHub issues because yeah, let's say we need more material, more information on this. We provide some introduction solution. Yeah, please.
Yes, maybe if I conclude, and correct me if I'm wrong, but probably we should identify the needs. So that's for member state needs for procedure. So something that we would call for now procedure, and then also a definition, a common definition of procedures. It seems that we have different views, whether they are official or not non-official. Let's say official meaning in a legal text, for example, in Spain, or not. So the need, I would say the need, and then a definition, a common definition of procedure.
Yes, and to add to this, Jean-Christophe, probably we need to determine the level of granularity, because I see there are differences between member states. So this information, we need to find a way to collect it for each member states, and the same applies to the previous issue. So all members of the working group and participants are encouraged to contribute to GitHub, but we will try to find a more maybe a more harmonized way to collect this information, maybe through a EU survey, which is a burden, as we know, for you to complete surveys, but it's also a nice way for us to collect this information and to get it and do the analysis. So please contribute to GitHub, and you will be informed about other ways of contributing the needed information. So yes. And if we don't have any other raised hands, or if there is no one else that needs to intervene, I think we can proceed immediately.
Yep. Yes. In this part of the webinar, it's just to announce that we've been releasing, let's say, the latest core vocabulary. There are minor versions on the core vocabularies. In particular, we have all of them have been updated. So you see it from core person, public organization, public event, and location. There are more editorial changes, I would say, some more readability, consistency. But then we have core business vocabulary and core criterion and evidence that received minor releases. In particular, for core business vocabulary, we have the power of attorney that has been integrated into, together with the legal status for a legal entity. And in core criterion and evidence, some changes, for example, in the labels for each, let's say, class inside the model. So we released version 2.3.0 core business vocabulary and 2.2.0 into the for core criterion and evidence. And as you can see also in the next slide, there has been a light update for the integration with the ADMS within at least core business, where the issue was opened for. So the idea is to distinguish basically before inside the ADMS identifier there are different properties currently, and we want to split them better in order to basically be identified and more flexible. So in this image, what you can see is the identifier class, which has the issue date and the notation, it's identified itself, and the schema agency inside the identifier itself. However, there are two relations where you see identifier is issued by an agent, and is a relation towards a schema where to which the identifier must conform to. So they have the schema name, and such schema it's also owned by an agent. So this is a separate, basically, let's say, version of IDMS itself that was needed in terms of core business to make it more flexible. Let's say the user identifier, which at the current state embeds all the properties in an identifier class, and there we try to split to bring more flexibility. But you will see this in the core business from the core business vocabulary. And that's it, I would say, from this announcement on the core vocabularies. Thank you for being today on the CPSV-AP.
Thank you very much. So before closing the webinar, I would like to ask if there is anyone that would like to contribute in the discussion with some final remarks or something that we missed to mention. So I don't see.
Can I say something?
Yes, yes, of course.
It might seem that we spent the last 2 hours talking and we came to no conclusions. I wouldn't think that. I hope that you don't think that. I think we need these topics need to be discussed, and we need to see different views and we need to, at least we got to a conclusion. The need exists to address these issues, and even though we need to research this more and investigate it, and before we have a final conclusion, I think it was a very useful hour and a half of discussion. So yeah, I hope you all feel the same, and let's try and figure this thing out, because it's a need that's been going around for quite some time now. Yeah.
Thank you, George. You wrapped it up in a very nice way. I don't have much to add to this. Thank you very much for joining. For us, And I hope for you it was very useful because we know what is the need and we know that we should investigate more. As George said, we will collect more information. We will reach out again on these two specific issues and we will follow up in the next webinar. Please be active and contribute in our GitHub issues so we will have a better idea what is going on and where we need to focus. Thank you very much for today and we'll be in touch and we'll see you in the next webinar. Thank you.